Kindly enter the consultation room with one attendant only and place your phone in the silent mode. Keep all your queries ready at hand and to the point. This will help us help you better. Following consultation, you have to proceed to photography room. Photographic documentation forms a vital part in the management of your skin-related complaints. The photographs not only help to evaluate the course of your skin condition, but they also give you a sense of satisfaction on improvement of your problem. This is strictly confidential. If you are prescribed any investigation by our consultants, then you shall proceed to laboratory in the 3rd floor. For Tricoscan or Photo Finder, proceed to room number 12. After your consultation, you can proceed to our pharmacy at the basement. Exhaustive list of medications for skin, hair and nail problems are available here. Kindly check all the medications and bill before leaving. The 2nd and 3rd floors are designated for procedures. This is where all lasers, aesthetic and minor skin procedures are performed. Kindly book an appointment in advance for procedures. We make it a point to have the most advanced and latest equipments to serve you in all aspects. Operation Theatre Complex is located in 2nd floor. This is where hair transplantation, vitiligo surgery, scar revisions and other skin surgeries are performed.
Yes, sir.
Doctor, you're in mute. Yeah.
Good evening, sir. Shall we start the session, sir?
Preeti, I think we can.
Yes, sir.
Yeah.
Sir, you can hear me, no, sir?
Yeah, I can hear you. What about me?
Yes, sir, I can hear. Little bit louder would be better, sir. Little louder, sir.
Little louder. Okay. Now?
Yes, sir. Now better, sir. Yes, sir.
Better. Okay.
Yes, sir. Sir, your screen is on, sir. Video?
It's on.
Yes, sir. Okay, sir. So, good evening, all. Welcome to the live session by Cutis Academy of Cutaneous Sciences, Bangalore, with the India's leading hair expert. The speaker whom we have today do not need any introduction. Dr. B.S. Chandrasekhar, sir, is world-renowned dermatologist and chief dermatologist at Cutis. Sir has ample amount of publication. You can already see in the screen. Sir has ample amount of publication and has done research in almost, you name any field in dermatology, any skin, hair, nail ailments, and sir has a research or publication in that. It is like that. So sir has been awarded the most inspiring dermatologist by Economic Times in the year 2019. It is one of the prestigious award. And sir has also been awarded the best IADVL Derma practitioner for the South Zone in year 2020. So now, without wasting much of the time, let me invite Dr. B.S. Chandrasekhar, sir, to take over the session and solve all your unresolved hair problems. Up to you, sir.
Thank you, Dr. Preeti, for a very nice introduction. And it is nothing called unresolved problem. There are some problems which even today we are finding it difficult to resolve. Okay. So let me start. Can you share the screen? Yeah. We know that hair is a crowning glory. And to be specific, to be honest, hair is not required for a healthy living. It's a vestigial organ. But hair has become an ornament now, because you need to care that, you need to caress the hair. Absolutely fantastic tactile stimulation and tactile sensation and tactile satisfaction comes when you touch the hair, the beautiful hair. So it's a dream that everyone would like to have head full of hair and a beautiful hair, and the hair which is shiny, which is bouncy, which is smooth. That's love for everybody. So let me take you through a journey of what is this hair fall, what is this cycle, what are the common problems are there with the hair, and how dermatologists, who are really called true trichologists. In the beginning only, I'm telling that probably the dermatologist is the one who knows the hair science. He studies the hair for about 3 years in his post-graduation. He knows in and out of hair science. They are the true trichologists. So you need to address your problem to a true trichologist who is a dermatologist, not the advertising clinics or something which is put up on the roads and which is there in the newspaper, which is there in the media. A true hair specialist is a dermatologist. So look at the hair growth cycle. See, normally in human, you have these three major kind of hair cycle. Why do you want to understand the hair cycle? Because you should know what you are suffering from belongs to one of these cycles. For example, if you look at this anagen, which is a growing hair, if you are taking a chemotherapy, if you are taking an immunosuppressive therapy, now you know about the COVID era, you suffer from COVID, you start losing your hair because of medicines. The growing hair in the growth phase only get lost. We call it as anagen effluvium, which is very, very common with the chemotherapies. And the second one you see is the catagen, where the hair is already, it is resting. It is about to fall out of it. So that is a catagen. And telogen is the third one. The best example I would give for telogen for a normal person to understand is postpartum hair loss. After pregnancy, 3 months after delivery, the hair loss starts. We call it as postpartum effluvium, or it's called as telogen effluvium. Similarly, a patient who is recovering from typhoid fever, malaria fever, or a severe viral fever like dengue, or for example, now we see lots and lots of cases of post-COVID hair loss. Either the disease itself, which runs for about 14 days if you get admitted to the hospital, or the stress associated with the COVID itself causes huge hair shedding, maybe 15 days or 30 days or 4 weeks after you suffer from COVID disease. So these are the cycles of the hair, which depends. Why I wanted to know, you should know. The growing hair is called anagen, the resting hair is called telogen, and the hair which is about to fall is called as catagen and telogen. See, this is what all about. Some people will have a very, very long hair like Akamahadevi, Vaitic character, and see this particular lady who has got a wonderful hair, but still she loses hair. She gets a bunch of hair, but the number of hair she is losing is less only because her hair is very, very lengthy. She shows a ball of hair. It's a concern for her. I always tell my students, my peer group, that hair loss is a personalized problem. We all say that if you lose around 60 to 100 hair per day, it's normal loss. But that 60 or a 50, 40 is a matter for a patient. That's what I tell. It matters to the patient. They come to us, we educate them what is normal hair shedding, how the normal hair sheds. But in spite of it, it's a concern. So a person of this lengthy hair brings about a ball of hair. We feel that probably it's around 30 or 40 hair because it is rounded. It's welled. That's why you get a ball of hair. Why I'm putting this slide? Because this is anagen hair. This is also anagen hair. That means your quality of the hair with respect to its length depends on the anagen cycle. Anagen is a growing cycle of the hair, which is fixed for each individual differently. People have got, normally it runs for about 3 months to 3 years. Those who have got a short anagen, like 6 months or 8 months, you can see the third photograph here, the short curly hair. They have a short anagen. Their hair goes only for about 6 months, falls, regrows again. Whereas these kind of patients, they have a long anagen phase. The hair starts growing till for about 3 years, 4 years, 5 years. That's why it's a long, lengthy hair. So the point is, when you look somebody who has got a very, very long hair and you don't have such a hair, please do not worry. They are not putting any manure to their hair. Maybe they are caring hair because it's beautiful, but nothing called a manure, a ready-made food for the hair, because their length of hair growth is longer than yours. That is the point. Normally, you call it alopecia. The hair loss is generally termed as alopecia in medical terms. And there are many types of hair loss, which I'm going to tell you. These are some of the hair loss with the photograph. The first one, what you see, is an androgenetic alopecia. Very, very typical, common complaint which comes to a dermatologist. Baldness, common baldness, male pattern baldness, female pattern hair loss, female baldness. All these, majority of the patients belong to this group of hair loss. Then in the second one, you have female pattern. This is similar to the male pattern. In males, we call it as androgenetic alopecia male pattern. In female, we call it as female pattern hair loss. Then the third variety is a common one called alopecia areata, where you see a round patches, you are losing hair. And you call it as scarring alopecia when there is a permanent scar on the scalp where you can't grow the hair beyond. You cannot grow the hair in this area. This is called scarring alopecia. This is telogen effluvium, as I explained. It can be a postpartum hair loss, or it can be a post-COVID hair loss, or it can be a post-dengue hair loss, or it can be a post-stress hair loss. There are lots of stress for us. Financial stress, family stress, relationship stress. These kind of stress, when they run for more than 3 to 4 weeks, they produce hair loss. This is called trichotillomania, the next one. Here, somehow, because of anxiety or because of depression or because of some psychological background of a patient, they start pulling their hair. I've seen this in children who are studying for exams. They start playing with hair and pull it off. People, they're not aware of it many a times. Parents come and tell us that I see a lot of hair on the bed, I see a lot of hair on the floor, I see a lot of hair on the pillow, on her study table. All these things because this is termed as a trichotillomania. As the name indicates, tricho means hair, tillo means pulling, mania is some maniac, huchu, that's called in Kannada. So it's called trichotillomania, completely curable. Then you have the last one is anagen, chemotherapy hair loss. Patients who are on a liver transplant, kidney transplant, lung transplant. These patients are put on chemotherapy to suppress the autoimmune process against the organ. So they lose this anagen hair. And those patients who are also on chemotherapy for cancer, any side of cancer, they lose hair. The commonest pattern hair loss is called androgenetic alopecia. If you look at these photographs, probably you don't worry about the theory, what is there. If you look at these photographs, see, this is the first stage of alopecia, grade 1. And maybe if you don't care for it, in a matter of 8 to 12 years, you can come to this grade. This is the last grade. There's a grade 8, grade 7, grade 8. Similarly, in female, we have this kind of hair loss. Normally, females do not lose hair like this. They normally get a thin hair on the vertex, on the central scalp, and it's graded into 3 grades. So why does it happen? It happens because simply, if you look into the reasons why, basically, there is a hormone called DHT, which is a derivative of testosterone, which regresses the hair on the scalp. At the same time, it simulates the hair on the face. That's why you get hirsutism or a hypertrichosis on the face, especially females I'm talking. And when the same hormone acts on the scalp, it makes person bald, either a male or a female. The second probably is a genetic background. If your both parents have got the baldness, probably your inheritance could be 40 to 60%. If one of your parent is around 30 to 40%, is how it goes. How does it happen? I want to explain it in a very simple term. See, normally the hair, what we have, will have at least, this is called hair follicular unit. Each hair follicular unit can have 2, 3, or 4 hairs. This is predicted as a 4 hair. When you have this kind of one follicular unit carrying 4 hairs, your hair is dense, thick, beautiful. When you start losing hair, you can observe here, each individual follicle goes for miniaturization, it is lost. The second follicle lost, third follicle lost, fourth follicle lost. Ultimately, the hair becomes thin. See, this is the gradual thinning of these. This is called primary follicle. These are called secondary follicles. The secondary follicles goes for regression. You lose hair by hair by hair. At the end of it, you are left with only a soft, small hair. Probably if you stand and look into the mirror on a bald scalp, you will see fine hairs like a small coat of a sheep. So it's called a miniaturized follicle. And this is exactly what happens. With those full follicles, your hair is thick here. And when you start losing those hairs, it will become like this. And when it becomes totally like this, you will become like this. So this is a gradual progression of baldness, which goes cyclically, year by year. You start becoming bald and bald and bald. Initially, you lose your frontotemporal area. Next, you will lose in the center. Next, you will lose on the back. So this is how the miniaturization process. This is called medically miniaturization process of a terminal hair. This is your terminal hair. This is your thick terminal hair. And ultimately, this is what is going to happen to your hair. So it's a gradual process. Second variety is alopecia areata. You get bald, totally bald patches, no itching, no scaling, no inflammation, nothing. You see only patches of baldness in between the hair. This is alopecia areata. Then you have scarring alopecia. There are many disorders which produce a lot of inflammation on the scalp and the hair goes permanently off. You cannot regrow the hair at all if you don't recognize this particular disease in an early stage. It is possible to recognize. You will have to meet your trichologist, who is a dermatologist. When you are feeling that there is some itching, there is some redness, there is some bogginess, there is some swelling, and you are losing hair from there, you should immediately meet the doctor. These are some of the connective tissue disorders where you lose hair. This is the examples of discoid lupus. It's an autoimmune disease which is affecting the hair follicle. Then you have folliculitis decalvans, which is a very, very resistant infection which causes, and this is one peculiar condition called lichen planus, which leads to frontal fibrosing alopecia. Gradually, the person starts losing hair and becomes completely bald. This is anagen effluvium. In the beginning only, I told you that this occurs because of some of those chemotherapy agents, like alkylating agents, it happens, okay? And it also happens because of the radiation therapy for cancer. Then there is one condition, as I told you in the beginning, the trichotillomania. You see, this particular child is pulling the hair out of the scalp. You can see this is not affected. And as she gradually goes beyond, first she will pull here, again next she will pull here, next she will pull here. By the time she comes back, this would have grown. Again, she will start pulling here. It's easy to pull from the center. This is called trichotillomania. Then this is the chemotherapy hair loss called HIV and AIDS. All these patients lose hair because of the chemotherapy or because of the disease process. Then you have malnutrition. The most commonest cause for hair thinning, hair shedding is iron deficiency anemia. In children, it is protein deficiency. So this is what one of our patients, you can imagine, just because she had a low iron, maybe she had around 1 or 2 nanograms instead of having 70 to 400. This is how she presented with us. Then this is a lupus erythematosus, an inflammatory disorder. This is a chemotherapy-induced hair loss, and this is the last one is called the one more inflammatory disease of unknown origin called sarcoidosis, where you lose hair. So to all these hair loss, pattern of hair loss, which I shown you, the most important hair loss is what we see in our clinical practice. In a day-to-day, our outpatient department is the pattern loss, androgenetic alopecia in a male and female, and the second one is telogen effluvium, third one is alopecia areata, and of course, now, because of the modification in the lifestyle and the stresses undergo, we see a lot of patients of trichotillomania, especially the youngsters, the teenagers and children coming with this disorder. The most important thing, when you are approaching an age of 50, 55, 60, you have thin hair naturally. It's called senescent alopecia. We need to respect the tissues. We need to respect the nature. The nature makes your hair thin. The diameter, the size of the hair come down. Then the density of the hair come down. Then the outer coat of the hair becomes fragile. then hair surface properties deteriorate, the light, the shine goes, the bounce goes. This is a natural deterioration. Can you reverse it? Yes, it is possible, because hair is a very, very dynamic structure. It's metabolically very, very active. You can reverse changes to a certain extent. Of course, not to a great extent. I cannot make a 50 or 60-year-old a person's hair to a 20-year, not possible. But decently, we can do some modification in this. How do you do diagnosis? We have several tests. If you meet a dermatologist, probably they would put a dermoscope under and they will examine you and they'll pull the hair. I'll show you. Then they are going to do a biopsy or something like that. This is how the diagnosis is made. Very easy. This is called a pull test. This is, you can see the pull test. What I'm doing here, I'm holding the hair, I'm pulling it. If I get more than 10 hairs, that indicates you have an active shedding. You require immediate intervention to stop your hair loss. If you're getting between 5 to 10, it's a warning. You should meet your dermatologist, your trichologist to get rid of it, what is happening, to get into the what is happening, to diagnose what is happening, so that it prevents you from further baldness. And the third variety is you don't get hair at all. This is here, and you don't get hair. It's a normal. So when some patient walks into my chamber, and if I see them that they have a beautiful hair on the scalp, and I don't see any deterioration in the density, and I don't see anything abnormality. When I put my dermoscope, I see a beautiful, robust hair. Nothing is happening. Then they tell, no, doctor, I'm losing hair. I'm really shocked. So much I lose the hair. Then I ask them, how much do you lose the hair? No, there are hairs everywhere. Then can you quantify it? No, doctor, I cannot quantify. Then what we do is we put our finger, we do the pull test in all the quadrants. And if you are getting more than 10 hairs, as I said, it's a disease process. We'll have to check. If it is 5 to 10, it's a warning. Probably you are in the entering stage of hair loss condition. Less than 5 hair, nothing to worry. This is hair pull test. Then, of course, some conditions we do a biopsy. In some conditions, we do a daily hair counts. How much they are using, more than 100. See, here written is less than 100 is a normal after shampoo, and up till 250 is normal after shampoo. This is what is, see, it is subjective. You will have to meet your dermatologist, get convinced them yourself that what is normal for you, what is abnormal for you. Then these are different types of hair loss at a glance. What I spoke to you now, there are 3 types. First type is the commonest type is androgenetic alopecia. Second types, we have scarring alopecias and normal telogen effluvium. Third, we have this cancer-induced hair loss. And there is a variation on gender, genetic causes, and growing age. How do you control hair loss? Doctor, I have hair loss, but I'm not finding any reason why my parents, none of them are bald. My grandparents my tata had a very beautiful hair, strong hair, even at the age of 80. My granny has beautiful long hair. Why am I losing hair? What is wrong with me? Is there any general measures which I can take to prevent? Because as you say that the 60 to 100 hair is a normal loss, I feel that I'm losing around 40, 50. I do not know when I'm going to reach 60 to 100. Can I have something which I can do? Yes. Eat a nutritionally balanced diet, which I'm going to tell you. Avoid tight hairstyles such as braids, buns, and ponytails. When you tighten the hair and pull it across, there is a pressure exaggerated on the hair root. See, androgenetic alopecia is also because with the pressure of the forces of the muscles which are attached to the galea neurotica, aponeurotica to the scalp. So that's a slow pressure. Pulling in the pressure causes baldness. That is a recent theory which is to be believed. Still the research is on. Like that, when you pull the hair, like you can see, normally it's happening in the sick population. If you happen to have a sick friend of yours, and if you slowly see the turban, you can see probably a crown or a corona of hair loss, an arc of hair loss in front because of those. So don't do that. Don't have that buns, ponytails. And of course, now that fashion has gone. Before I used to see some male population also tying the hair and putting it. Now it is a different hairstyle altogether. So treat your hair gently when washing and brushing. A wide-toothed comb. Always don't use a narrow-toothed comb because it pulls your hair. Then avoid combing in a wet condition. I see that many people practice immediately after bath, they start combing their hair. Don't do that. And harsh treatment, especially I would like to bring your notice here. I would like to bring your attention is a lot of parlor procedures, rollers, curling, ironing, steaming, then all these washing, all these parlor procedures are good, maybe for a lifetime function like a marriage or a housewarming ceremony, something like that. If you it becomes a habit for you. If you start going to the parlor once a week, once in 15 days, or once a month, and put all these chemicals on your hair, it withers your hair, it damages your hair. We see a lot of cases from morning till evening, the damaged hairs because of the parlor procedures. You need to be extra careful when you think about these kind of procedures, especially these hot oil treatments, these permers, these hot rollers, because see, hair follicle is highly sensitive for temperature. It's sensitive for temperature. If the temperature of the follicle rises, the follicle dies. And if there is a harsh treatment, the shine on the coat on the hair goes off. So you need to think 100 times before you please get into the parlor procedures for your hair. Be very, very careful about it. Then the treatment, we have androgenetic alopecia. We have the standard treatment of minoxidil finasteride. Once you get into your dermatology office, they will exactly see what is the condition, how to treat, because individual patient is different. You cannot extrapolate the same treatment for another patient. I see a lot of my patients, they come and we write a lot of minoxidil and all those things, and they start telling to their friends that use this, it will become normal. But they will not understand what is the grade of alopecia which the patient is suffering from. You should know the grade of alopecia, then only you can treat. So you meet your dermatologist. So we have for female population, we have hormonal therapy, then we have so many therapies which are available for hair. This is the outcome. See this photograph. This patient has taken treatment only for about 3 months. See the beauty of recovery. If you happen to go with this kind of baldness to a non-dermatologist, a non-true trichologist, they would put you a transplant immediately. They will put you into that. There's no doubt about it. But it is possible to recover with medical line of treatment. You see this particular person in a matter of 3-4 months, how beautifully his hair, the scalp is getting covered. A female pattern hair loss, a female, you can see before minoxidil therapy, how she is at beautifully recovering the hair over a period of 6 to 8 months. It is possible. Medical line of treatment is possible very, very nicely. Then, if the medical line of treatment falls, we have additional treatments called advanced therapies, which I am going to tell you last. But the another way is a hair transplant, which gives a complete full life to your hair. It's one of the most gratifying permanent hair therapy which is available. Before you get into the transplant, you need to meet a very, very proper dermatologist, trichologist, so that they understand the dynamics of your hair, dynamics of your age. What is going to happen if your age continues? What happens to baldness after the transplant? There are a lot of intricacies which have to be looked into before you embark yourself to a transplant. This is one of the wonderful way or the gratification of a patient with a transplant. You can see the beautiful hair growth. Similarly, another patient with a transplant who failed to grow the hair further with medical line of treatment. Then you have another patient which is almost hopeless condition. You can see a transplant, post-transplant photographs. Similarly, even in a female, you don't have to worry. You don't have to lose your heart. It is possible to do a transplant. This is one of our patients who had hair loss in the frontal area and grew the hair after the transplant very nicely. And remember, transplantation is going to give a permanent hair at least for a period of 15 to 20 years. It is possible. Wonderful. Okay. That means that transplant is not a permanent solution for hair. It is not the only solution for hair. Remember, you have an area of 40,000 hairs here, which I am showing you. And you are going to get only 4,000 follicular units, approximately 10 to 12,000 hairs. How can you think of putting maybe about 10 to 12,000 hairs in the area of 40,000? It's not possible. It is possible, but it is not going to be gratifying. That's why, along with the transplant, you need to continue your medical line of treatment. That probably the dermatologist will tell you. And this is the alopecia areata. It's a beautiful treatment is available now. It used to be a hopeless condition a decade back. You can see the beautiful growth of this hair just in a matter of about 3 or 4 months. This is the outcome, complete regrowth in alopecia areata cases. And this is chemotherapy-induced alopecia. You can see after the immediate chemotherapy, patient has this, and this is what she gets in a matter of 6 to 8 months. The mean to say, whatever may be the type of alopecia, if you can meet your doctor at a right time with a right dermatologist, you're going to get a beautiful result. Similarly, I was telling you a hair pulling disorder called trichotillomania, and this is what happens in a matter of another 6 to 8 months for this patient. They require probably a psychotherapy. We counsel them, we treat them. Then this is the telogen effluvium, a common hair loss after the. I was giving an example in the early phase of my talk that post-COVID, post-typhoid, post-dengue, all these conditions can be treated very nicely. The hair promptly grows back in a matter of, say, around 4 to 6 months. And this is what hair requires. Many of the times, patients ask, doctor, what should I eat to have a good hair? What is the best diet for hair? These are the questions we get. These are the things we get normally. Yes, hairs require nutrition. Why does it require nutrition? Because hair is a very dynamic structure, metabolically very active. There are 2 tissues in human body which requires energy all the time, microminerals all the time, proteins all the time. What is that? One is the bone marrow. That's the blood. Your blood is manufactured in the bone marrow. That is a highly dynamic structure. That requires high-grade nutrition. Second one is the hair follicle, highly metabolic tissue. It requires a lot of energy. So what does it require? It requires microminerals, it requires vitamins, it requires proteins. So this is the proteins, these are the amino acids you require. Fat, of course, you don't require much for the hair. You require minerals, you require vitamins. This is a general thing, what is there in each. So that means to say that if your diet has got egg, oyster, blueberries, sprouted lentils, fish, walnuts, green leafy vegetables, and yogurt, and especially now the research has opened up millets. Millets give you a wonderful hair food. So if you can adopt millet, you can adopt some of the sprouts, then badam, then pomegranate fruit, then green leafy vegetables. That makes a beautiful hair food for you. So think about it and say, food for thought. What are the advances for hair therapy we have? We must have heard of PRP. This patient was there for a very, very long time with us. He could not achieve anything else. He could not afford for a transplant. Then we started PRP. You can see the beautiful way of PRP in a matter of at least about 4 months. Then the female pattern hair loss, you can see a wonderful result of a hair platelet-rich plasma. It's very simple. We take about 20 ml of blood from your body. We have a specialized centrifuge. We centrifuge it. We take the hair food from the platelets. Platelets have got multiple growth factors like a beta F. You don't understand all those. It simply means there are growth factors in the platelets. We extract the growth factors from the platelet. We make a Cox solution. We inject it to the area. And once we start that, after about 6 sessions, what you are going to get. This is only after 3rd session. But we do it for six sessions. Many a times, PRP is loved by so many people across globe. They do come voluntarily, get their PRP done once in 4 months to have a beautiful bouncy hair. Then we have a micro needling for hair growth. This is called a derma treatment, which is available. You can see a beautiful growth of the hair. See, these are all add-on therapies. These are all standalone therapies. Please remember, it's therapies. Then you have a low-level laser therapy. I think few of the centers across India have got low-level laser therapy for hair fall. It's a male pattern hair loss after low-level laser therapy with the standard treatment along with. This is a female who gets. See, all these factors we are telling us advanced, they're all add-on therapies for hair growth. They are not the standalone therapies for hair growth. Then this is one of the patients who underwent the low-level laser therapy. We have advanced stem cells. We have a technology where we take about 16 hair follicles from the scalp. We separate the stem cells from that. We separate the growth factors from that, and we inject to the entire area. This is what is the outcome. And this is what is the outcome with stem cell therapy, Regenera Active Medicine. And there are complaints that patients do not only scalp, they also come with the low beard, less beard. They also come with the less of the eyebrows. They say that eyebrows is thin. We have a tattooing technique called microblading. You can see a wonderful result in just in a matter of immediately after the procedure also you can see, and it stays for about months and years. This is again hopeless cases where you can't do anything. He's totally bald. I have no hair on the scalp, on the back portion, which is called the donor area. This is called the donor area of the patient to get the hair transplant. That also is not there with me, doctor. What should I do? You can simulate hair follicle by doing a micropigmentation. That's what you can do. And this is what micropigmentation does. And this is, again, advanced technique to diagnose hair disorders. We call it as photo finder. It gives you a complete analysis of the length, diameter, and number of hairs per square. Beautifully, it gives everything. And this is the most advanced technology we have to analyze the hair, to fix your problem, and to tell what exactly you need. And the last time, what is all this about? I spoke about almost about, I would say that 30-35 minutes so far. And I'm able to tell you that what are the types of hair loss, what should you do for hair, what is the importance of hair, how the baldness results, what is the psychological effect of baldness, what are the different types of baldness, hair loss, how are we going to recognize those hair loss, whom you should meet, a true trichologist, a dermatologist you should meet, and how to treat that hair loss, how your dermatologist is going to treat hair loss, what are the different types of treatment, and more importantly, what are the outcomes. I've enlisted for all the alopecia areata, androgenetic alopecia, every disorder I've enlightened that what is to be done, if it is properly done, what is the result which comes. That's what I've spoke. Ultimately, the hair loss has got 5 limbs, like a Devi, 4, 2 hands, 2 hands this side, 2 hands this, and 1 head. That is, you will have to have a medical management immediately. You should identify your dermatologist, go, they would treat with you drugs. Surgical option is hair transplant, non-surgical is PRP and all those. Then they will advise you regarding the nutrition. And I've told you, I've given a glimpse of nutrition. Then you will have to weight management, especially with respect to female population. When you are becoming bald like a male, you should be watchful about your weight. That's what your doctor is going to tell. Then, of course, you have an emotional breakout with alopecia areata, where you start losing breakout of the hair. Then trichotillomanias, we need to have an emotional support to this patient. That is possible with the dermatologist. Then ultimately, if nothing is working for you, you are not a candidate for hair transplant, and you are not a candidate for other treatments, but still you can have a modification of your hairstyle, you can have camouflages, you can have hair pieces, you can have wigs. So there is no end. As I told you in the beginning, hair is a beautiful organ in the body. Everybody would like to caress the hair. It's an ornament. So you can care for your ornament. Even if you don't have that ornament, there are methods to camouflage yourself. So thank you very much for your patient listening and the open for questions. I think this talk would have brought you a basic idea about hair size, and hair loss. Thank you.
Thank you, sir. That was such an enriching talk, sir. Every time we listen to you, sir, like there is something more to learn. I've been listening to you from a long time now, sir, but then every talk of yours, there's something more to learn, sir. Thank you, sir. So now I hope all the audience over here are enlightened and inspired to take care of their hair effectively. So, sir, we are open to questions, sir. We have a brief question answer session now. So, yes, audience over here and all our Facebook and YouTube, wherever it is streaming, you guys can ask the questions and we are here to answer it. Sir is available for you to answer it. So, sir, let's start.
If you have any questions in the chat box, I think look into it and let us take up one by one.
Yes, sir. Yes, sir. Sir, there is one, Mrs. Sumulata has asked, she wants to know a good conditioner, sir, for her hair. Unhealthy hair, dry and the unhealthy hair is what she's facing. So she's asking for a good conditioner.
Okay. So this is one of the commonest requests from all people, especially females, that doctor, what is the best shampoo for me? What is the best conditioner for me? And what is the best hair oil for me? Whether Brahmi hair oil grows the hair, whether some other hair oil grows the hair, Ashwini grows the hair. These are the commonest questions we can. I'd like to address each one. With respect to your shampoo and the conditioner, all major companies which manufacture conditioners are all high quality. Personally, I visited Hindustan liver manufacturing process. I think it's mind-blowing that they maintain high quality. So ultimately, when you use a conditioner, if you ask me what is the best conditioner, I can recommend you any condition from any of the major companies, Hindustan or a Lakme or a, whatever it is. So many companies, Schwarzkopf, all these companies. The only thing is that when you start using this conditioner, if you don't like, it's all feel good factor. If you come to a medical conditioner, it's a different issue. When you come to a medical conditioner, the dermatologist has to examine you, should know the nature of your hair, then probably he should advise. But generally, any standard company, high grade company like L'Oreal, etc., they manufacture very good conditioners. Use it, use about 3 or 4 conditions from different companies, and whatever which makes you happy. When you are coming out of the bathroom or putting the conditioner and washing it out, if you feel happy, choose this conditioner. Similarly, with respect to shampoo. Plus, do not go for a sachet shampoos, because sachet shampoos are always low grade shampoos. Always go for a bottled shampoos and bottled conditioner. That's my advice. With respect to hair oil, you can apply hair oil, but do not apply to the scalp. Okay, your scalp is enriched with oil glands. Each hair follicle has got a wonderful sebaceous gland which produces oil and keeps to your scalp skin. So do not apply oil to the scalp skin. If at all, if you want to apply, you can apply to the hair. It can be Ashwini hair oil. It can be any other hair oil. It can be Patanjali, whatever you like. If you ask me the best, it could be a non-perfumed best hair oil. Probably what you can find out. And normally I look into a parachute hair coconut oil because it has got a legacy behind. So you can choose that oil. Yeah.
Sir, they have also asked, how important is it to use a hair conditioner, sir?
It's important. It's important because we get exposed to a lot of environmental factors like sunlight, like a blowing air, then the pollutants. It is really a conditioner. See, who has to use a conditioner? One who has got a harsh hair, okay? One who has got a dry hair. Your hair is not able to be cold. Hello?
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 Sir, I am talking from Bagalkot, Seychelles, Kamath.
Yes, tell me.
Sir, actually, I have taken a treatment from you, sir.
Yes.
When I'll tell you dates, actually. Visiting date was 6/3/2021.
Yeah, you can go ahead. Yeah. Probably see, this is the forum where the general questions are addressed. And if you are able to connect us on a telephone personally, so that we can talk to you tomorrow, because this it's a time constraint, so that since you are a patient of Cutis, we are very happy to serve you when you call tomorrow morning.
Thank you, sir. Thank you.
Yeah. I was talking about hair oil. So hair oil is a conditioner.
Hair conditioner, yes, sir.
It's a hair conditioner. I told you where you apply dry hair, withered hair, where the hair is not soft. It is not sitting within half an hour to 1 hour after you going out of your home. Probably you feel that the hair is dry, lusterless. People don't like your hair. Those are the patients who have to use conditioners. So if you can condition your hair once or twice a week after shampooing, probably that is the best way. If you have got worst dry hair, you can use a leave-on conditioners. Normally you apply conditioner and wash it off, but there are leave-on conditions where you apply the conditioner and leave it on. So that is how. And if you still further feel that your hair is not getting right with your conditioner, that is the time you should meet your dermatologist. They will advise you what to do.
Sir, Navya, one of the patient, Navya has messaged us in asking about how to grow hair soon, sir. She has recently undergone, I guess, tonsure, so she wants to grow the hair soon. That's her query, sir.
Yes, there are peptides available. It's a wonderful question from Soumya. What's her name?
Sir, Navya.
Navya, wonderful question. And see, if you look at the beginning of my talk, I told you there are 3 phases of hair: anagen, catagen, and telogen. And if you want to increase the anagen rate of your hair, you have wonderful peptide serum which are available. Meet your dermatologist, they would give you a prescription and you can start applying the peptide and it grows really well and fast. That's true.
So Mr. Dinesh had asked whether we are working during this lockdown and whether PRP is done. So I have already messaged him that we are working and he can come and get done the PRP.
Yeah, we are, because we see that the Cutis has got a wonderful installation of Shaiko can. We installed it about 3 days or 4 days back. The beauty of this device is it is going to eliminate 99.9999% of the virus in the air. So in that way, we have taken a wonderful care at Cutis. In each floor, we have the Shaco cans. People can walk in very, very fearlessly to the Cutis. Absolutely, there will be no virus. That's for true.
Hello, sir.
Sir, actually, we have already, sir, in your talk, you have already told about supplements, sir. But then one of our patient, Anaga, wants to know about any particular supplement during PCOD. She has hair loss due to PCOD. So she's asking whether any particular supplement which she has to take.
No, Anaga, is it? Okay.
Yes, sir.
So Anaga, I would like to tell you that the best treatment for PCOD is weight loss. I don't know what is your weight. It depends on your height and age. You need to, there is nothing called a supplement for PCOD. Don't believe that. Of course, there are tablets which contains myo-inositol and all those things, Kenoform. They have to be prescribed by a doctor. And absolutely, there is nothing called a diet for PCOD. You will have to reduce your fat intake. You will have to reduce your calorie intake. You have to consume more of proteins, more of minerals. Probably if you can be conscious about your diet, your calories, that would help in bringing down PCOD to a great extent if you reduce your weight.
So the next question is from Manjuda and Mr. Riaz. Both of them want to know the role of onion juice in hair growth, sir.
See, basically, Dr. Preeti, onion juice is an irritant. Okay.
Yes, sir.
So anything which irritates hair follicle is supposed to stimulate the hair follicle. But the problem is you cannot quantify onion. Okay. You cannot quantify onion, correct? What is the percentage of onion juice which is required?
Yes, sir.
Because when you take a percentage of peptides, we put it as 1%, 2%, or for a common being, if you use a Fair and Lovely, what is the amount of niacinamide for fairness in Fair and Lovely? It's around less than 1%, correct? In medicine, we use 4%. Similarly, onion juice is an irritant. It can be applied for alopecia areata, but there are some people who have used it for androgenetic alopecia. They claim that it's a good result, but I've seen more harm. Irritant dermatitis, the skin get irritated, then come to the doctor with a lot of irritation, pain, and itching. So onion juice is there. It is a modified juice now. It's available in medical terms. We also prescribe it. You will have to take the prescription version of onion juice rather than going for a raw.
Yes, sir. Sir, any home remedy also they are asking. Mrs. Manjuda is asking.
Home remedy for what?
For hair loss, sir. For hair volume. Increase in
Hair volume.
Sir.
Yeah, for this diet, I told you. And you will have to improve the anagen phase of the hair. And probably if you don't have any pattern hair loss, like baldness, common pattern baldness in female, if you got a very, very healthy, robust hair, you can do a gentle warm oil massage. Maybe 1 hour before you go to, before you take head bath, probably that would stimulate your hair follicle. Please do not apply anything overnight, whatever it is, especially hair oils. We have a bad habit of applying hair oil and leaving overnight, taking next day bath. It's very, very dangerous and not good because your oil is a food for fungus called Pityrosporum mobile. Your scalp has got an inhabitant called Pityrosporum mobile. It's a fungus. It grows on oil and you are feeding oil and your dandruff will increase. Dandruff leads to a lot of inflammation. A lot of inflammation leads to hair loss. So I don't recommend overnight hair oil.
Sir, just to mention, Lata and Saujanya, kindly call our contact number so that we can address your issues individually. So they have other problems.
We can do that. I think I suggest my team to note down all these questions and individually we'll address their issues. Definitely we'll do. We'll love to do it.
Sir, one more question is from Yash. Sir, he has dry scalp, no dandruff. But he gets white flakes after hair wash, which is leading to acne on the face. This is
this is one issue what we see, Dr. Preeti, every now and then in the clinic, and this is called probably an atopic scalp where there is no oil but dandruff-like scales are present. Correct. So you will have to lubricate your scalp. The lubrication has to be done with a mineral oil, not with a vegetable-based oil. Normally, probably Yash should have been applying a coconut oil or a castor oil. That is not recommended for his problem. He has to go for a mineral oil. Mineral oil is available as light liquid paraffin. Probably one of the best brand for mineral oil is Live Oil. That he has to apply. And he has to have a descaling shampoo. That probably he can get a prescription from his dermatologist.
So little bit extending this question because a lot of
Yes.
questions are on dandruff, sir.
Okay.
So how to control dandruff? Which anti-dandruff shampoo? Most of it we have already addressed, sir. But still, they're asking again how to
The
control.
anti-dandruff shampoos are of two classes, Dr. Preeti. One is on over-the-counter shampoos and doctor-prescribed shampoos, correct? So
Yes,
over-the-counter shampoos, if they have zinc in them, if they have a ketoconazole in them, they can use. And they have to use it 3 times a week minimum. If it can be washed daily with anti-dandruff shampoo, it's a very good thing. But at least minimum 3 times. How to use it? Enter the bathroom, wet your scalp, massage the shampoo to the scalp. Remember, it has to be massage the scalp. The normal habit of all of us is to massage the shampoo so we get a good lather on the hair and we enjoy the lather for some time, we should wash it off. Correct? It is not to be done. Anti-dandruff shampoos have to be left for at least for about 10 minutes on the scalp, at least for about 7 to 10 minutes. The best way to do it, enter the bathroom, put water on the scalp first, massage the shampoo, leave it off. You take rest of your bath, probably that would take 3 minutes, 5 minutes, 10 or even 25 minutes in some people. After the last of your wash, whatever you are doing, at the last, you wash your head and come out of the bathroom. That is the best way.
Chandrasekhar, one quick question.
Yeah.
Actually, most of the doctors nowadays are suggesting for minoxidil gel.
Yes.
So actually, is it? I don't know. Actually, I have no, got to from that internet and all. Sperm count will be decreasing. Is it true?
No, minoxidil is not doing anything with the sperm count. It's a lay press bad advertisement. Please do not have an apprehension about minoxidil. It is not going to do anything for your sexual health. Either a sexual drive or a sperm count or infertility, whatever it is. It's not going to do any harm for you.
Thank you.
Requesting again to everyone here, please put down your questions in the chat box. We will attend to you so that we can go in our order and give importance to everyone. So, sir, next question is about hair breakage, sir. Naga Soundari wants to know that she has a lot of hair breakage, it seems, sir. So, she wants to know what to do about it.
Hair breakage?
Yes, sir.
So, hair breakage, probably you'll have to analyze. You'll have to sit with your dermatologist and they have the instrument called dermoscope. Probably they look into your hair, whether your hair shaft is a problematic shaft, whether your hair root is a problematic one, or your scalp itself is a problematic one. And that's how you have a dry shaft. And when you have a dry shaft, hair breaks. Your hair cannot grow lengthy. It cuts shorts. So it is basically, the basic principle is the water content of your hair is less. Water holding capacity of your hair is less. It is not able to hold the water. Why it is not able to hold the water? You should dig into that, then you should treat. Generally, probably a mineral oil application, 30 minutes to 1 hour before bath, and a leave-on conditioner after bath would work for a dry hair and lusterless hair.
Sir, just extending the question by Anu.
Yes.
Anu wants to know, like, her hair gets very dry after wash. So she wants to know the same thing, I guess.
Probably, I don't know what Anu is using, what shampoo she is using. Okay. She has to use a very soft shampoo. What are soft shampoos? See, there are 2 principal ingredients in a shampoo called sodium laureth sulfate, lauryl sulfate. Laureth is laureth, Lauryl is lauryl. If the shampoo has got a lauryl, it produces good lather. Yes. Because it's a very bad chemical. If I got a laureth sulfate, it will not produce a good lather. Any shampoo which is producing a beautiful lather is harsh. It is strong. Okay? Yes. This could be a surprise for all the people who are listening to me. Please listen to me. If it is producing a beautiful lather in a very short time, in a very small quantity, that means the chemicals are high. That is going to damage your hair. So you have to have a shampoo which has got a soft lather, less lather, which contains laureth sulfate. Get into the ingredients of the shampoo, look for a laureth sulfate. All baby shampoos are laureth sulfate. All standard company shampoos from L'Oreal, Clinique, got laureth sulfate. So those shampoos have to be used. In spite of using such a standard conditioning shampoo, if your hair is still dry, the second thing, immediately after bath, after drying your hair, please apply mineral oil, not a vegetable oil. Okay. The mineral oil can be a light liquid paraffin. I told you the brand name already. And the third one, in spite of it, if your hair is still dry, use a leave-on conditioner which are available commercially. All the 3 fails. your dermatologist should help you. That is the way.
Yes, sir. Sir, actually, sorry, Abhishek Kumar and Mangala Devi, I'm just mentioning it to you that we will contact you or you can call us at our
Yes,
Cutis
please
numbers.
make a note of all these patients who have got those doubts which cannot be taken in a question answer session. We'll try to address them individually.
Yes, sir.
So please,
Because
the
their questions are
administrative
individual.
team, please make it a point to have their email address or their phone numbers so that we can address this issue.
Sure, sir. I've told the team, sir, because their
Yes.
questions are individual.
I know. There are a lot of questions. I see 70 in chat box even now. Yeah.
Yes, sir. Sir, how many days in a week should a woman wash their hair?
Ideally, recommended is thrice weekly. Thrice weekly is the recommendation because women have a long hair. And I love women if they wash it on a daily basis, which is practically not possible. At least twice a week, minimum it is. Ideally, thrice a week.
Yes, sir. Sir, again, is Cutis open during lockdown? Yes, we are open during lockdown.
We haven't closed even a single day, Cutis, so far in the lockdown. We are addressing the issues of our patients through mails, through telephone calls, through video consultation, through WhatsApp calls. And I'm proud to say that Cutis has never closed its door, either in the lockdown first or lockdown two.
Sir, Ashwini wants to know her new hair which comes is curly. So what to do to straighten the hair?
Yes, Ashwini, this is one problem which normally many people have got. So there, see, if you look into the hair shaft, which is different for different races, you look for a hair shaft in a Negroid race where you have a curly hair. The root itself is curly, Dr. Preet. The root itself like this, instead of like this. So whatever which is coming out will always come curly. It's very difficult to maintain this curly hair. Very difficult, but still possible. How? You have to have a very good conditioner, what is suiting for you, whether it's a leave-on conditioner. And you will have to choose a beautiful oil. You should know the type of application of oil, how to apply, how many times to apply, all this. This will take a long session for an advice for a curly hair because we have this problem in and out from our patients. And it is possible to a certain extent bring down their curliness and make them straight. It is possible.
Yes. Sir, Abhishek wants to know, because will topical minoxidil and finasteride solution work well for genetic hair loss? Because it was only recommended for me. I guess we have recommended him, sir.
Yes. See, androgenetic alopecia, Abhishek, is a genetic hair loss, where 40% of your problem comes through your ancestors. So the best combination for a genetic hair loss is a finasteride and minoxidil combination. There is apprehension from majority of the patients because of the internet bugs, I would say, regarding oral finasteride. Although oral finasteride side effect is seen only in 1.8% of the population. If 100 people take oral finasteride, only 1.5 or 2 will get a problem. But that's a big problem. It's blown out of proportion in the internet. Topically, when you apply finasteride and minoxidil, finasteride do not go into the hair, the circulation as the oral finasteride. So don't have any inhibition, don't have any apprehension about using topical finasteride and minoxidil that is given for androgenetic alopecia. It is alternately named in a layman's words as hereditary hair loss.
He is actually worried, sir, because FDA has not approved topical finasteride.
No, so it is not approved because they are not sure about the efficacy. See, FDA approval is always because of two things. The first is safety. Second one is efficacy. See, we have done a trial in Cutis regarding topical finasteride. Now there are at least about 20-25 trials. They have to go to FDA to get an approval. So till FDA approves, please do not worry. FDA is not something which is very great, which is very big. They have the common sense of a doctor, common sense of a citizen. FDA is only for a cover. If I want to cover myself, I can say it is an FDA approved. So don't worry about it. There are scientific studies went on that. We have done a trial and we have been prescribing topical finasteride minoxidil from a very, very long time. Hardly we had, maybe out of about 20 lakhs of patients whom I have treated, maybe 1 or 2 had an issue, but all there were because of the misinformation fed in the internet. Yes, Preeti.
Sir, actually there are 1 or 2 questions on here. Saujanya is asking why we shouldn't oil the scalp. And Nike is asking, what is the duration we have to apply the oil before hair loss?
I told already.
Yes.
See, every one of us on our skin, we have a fungus called Petrosporum ovale yeast. Okay, it's a yeast. Normally, if you cannot understand the word yeast, you can understand the word. The idlis are made of yeast. Your breads are made of yeast. And if you open your coconut at your home, or you keep a piece of bread at your home, after about 5 to 6 days, you see a black fungus growing or a white fungus growing. Like that, all of us got a yeast. Okay, that yeast loves lipid. It grows on lipid. So when you apply coconut oil or a mineral or that castor oil or olive oil on the scalp, you are feeding the fungus. You are giving food to the fungus. Thereby, it increases the dandruff. Dandruff always produces inflammation. So it's very, very bad to apply hair oil overnight and leaving it. Please do not do that. Especially if you have a baldness, you have a less hair, you have a hair problem. Don't do that. And the second part of it, oil is a very good conditioner. So you apply it half an hour to 1 hour before your head wash. Massage oil to the hair very well. Don't apply it to the scalp. A little bit of penetration into the scalp from the hair is fine. It's not to be worried at all. After that, you take a bath. No overnight hair oil.
Yes, sir. Just to mention, Madhuri and Gagan, your sir has already spoken about the issue what you have mentioned here. Kindly watch the recorded session of this live session in our Facebook and YouTube portal. Sir, next is by Mangala. She has asked, sir, I have started using hair joy now. They say first we lose hair, then new follicles will come up. My question is, after I stop using hair joy after next 4 months, will I again experience hair loss?
It's a beautiful eye opener for all the people who are using minoxidil. It's Mangala.
Yes, sir, Mangala.
Mangala. It's a beautiful concern. It's not a very. It's a valid concern from you. See, when I started my talk, I told you the 3 phases of hair: anagen, catagen, telogen. And when you apply minoxidil, what happens is the hairs which are in the catagen, resting phase, telogen, falling phase, they all fall out because minoxidil is producing anagen. It is producing a new hair from your follicle. When the new hair is coming out like this, the old hair falls. The new hair which pushes the old hair, it falls. So minoxidil does that. That's why in the initial stages of minoxidil, when you apply it, maybe starting from 15 days after the starting of application, to a certain extent, maybe to about 1.5 to 2 months, you will lose hair. It's a very, very good sign of minoxidil working. Remember, those who develop this sign will get a wonderful growth at the end of 4 months. It's a happy, probably notice or happy observation. I would put it as that the hair falls after starting the minoxidil. Then you continue 4 months, your hair loss stops, your hair grows to a certain extent. And if you want to stop it, please do not do that. Or your hair which is grown is because of the minoxidil what you have applied. You need to slowly reduce it, depending on your dermatologist's recommendation. Normally, we tell them to apply twice daily, or for a female, once daily. We make it for about 6 to 12 months. When the hair becomes normal, then we supplement the peptides, or we ask them to reduce the alternate days, something like that. Never, ever stop minoxidil for more than 3 days at any point of time. If you stop it, you will see a tremendous hair loss after restarting the minoxidil. Don't do that.
Doctor, is Racin Pro minoxide? What I don't know how to.
Racin Pro is not minoxidil. No,
okay.
It's a peptide. It's a peptide.
Okay.
Chaitra, kindly mute your audio. Sir, actually, Manjushri has a very good question.
Yes.
Manjushri is a patient who has recovered from COVID, sir, and
yes.
She is facing a lot of hair loss after that.
Yes. Post-COVID hair loss is because of 2 reasons, Preeti. Number 1 reason is the stress you undergo. Not only as a patient, I've seen relatives of patients coming with hair loss because the stress of losing them, kith and kin, makes you on a tenterhook for at least 14 days of your life, starting the day of RT-PCR positive. Okay, so that is one thing. The second thing, the medicines given for COVID, like if the patient get admitted, they're on the high flow oxygen for a long time, then they have a remdesivir, which is a powerful antiviral, then probably they are put on anticoagulants. All these have got detriment to the hair. So once you are come out of the COVID, maybe 2 weeks or 3 weeks or 4 weeks or 6 weeks after the COVID, you will start losing hair. It's called telogen effluvium. It's called acute telogen effluvium. That means the hairs which are in the resting phase. See, at any point given, at any point of time, out of 100 hairs in your scalp head, 85 are in a growing phase, 15 are in a resting phase. So these resting phase hairs will fall off once a new hair starts growing after the recovery from the disease. During the disease, your hair growth is stopped. It will not happen. So once the regrowth of the hair starts, all these telogen hairs, all the catagen hairs shed off. That's what you see it as a telogen effluvium. It's completely reversible. It's completely recoverable. Only you will have to meet your dermatologist or a hair specialist. I mean, only true trichologists or dermatologists, so that they would advise you. You don't have to get disheartened by that. It is going to recover very nicely.
Sir, Mr. Ganesh wants to start treatment with us. He's asking how long it will take to complete growth if I prefer to take medicine.
Ganesh, it depends on the grade of your baldness. What grade are you in? We'll have to examine you. It depends on the texture of your hair. It depends on the health of your hair. Overall, in general, you will be able to see a positive response in a matter of 4 months. You will get you an optimal growth by the end of 12 to 14 months and a very good growth or a good growth at the end of 24 months.
Yes.
As I said,
Yeah, I'm already under medication from Cutis.
Yeah.
It's been 3 months. I think I don't see any growth still. I mean, you said a few moments back that
normally every patient of Cutis, they do speak like that. When they come for a follow-up, we show them the pre and post-treatment photographs. They get astonished to see them. I don't know what has happened in your case. If you have not had a follow-up even now, please come for a follow-up in the next week. We are open and we'll check your old photograph and the new photograph. We'll compare. Normally, I tell you that 90% of the time, it will have a positive effect in 3 months. If it is not having a positive effect in the 3 months, we have to rethink about our diagnosis. We have to rethink about our treatment schedule. So please, when you come for a follow-up, you see to that personally, you meet me, or personally you call me, whoever the doctor who is seeing you. I'll come and examine.
Yeah, that's where I have a question. 1 week back, I had some health issues, so I didn't take medication for a week. I mean,
please start your medication. Before starting your medication, please do come. If you are not able to come, please take a video call. I'll address that issue.
Sir, actually we are out of time. It's 6 o'clock, 6:05. Should we continue? There are 75 new messages.
Ma'am, one last question is there.
One nimsha. You can ask. Just a minute. Sir, around 75 new messages is there, and also in YouTube and Facebook, there are a lot of questions. We are out of time.
I told you, please note down all those questions.
Sure,
absolutely, sir. We'll respond to them. No doubt about it. I personally take care of it, and I'll see to that they are responded.
Yes, sir.
Yeah.
Heli, yaru Vinod alla? Vinod?
Yeah, ma'am. ಹೌದು.
ಹೇಳಿ ವಿನೋದ್.
ಮೇಡಮ್, ನಾನು 2 years ಆಯ್ತು ಕ್ಯೂಟಿಸ್ ಅಲ್ಲಿ ನಾನು ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂತಿದ್ದೀನಿ. 2 years ಇಂದ ಚೆನ್ನಾಗಿದೆ. ಬಿಫೋರ್ ಬರ್ಬೇಕಾದ್ರೆ ನಂದು ತುಂಬಾ ಉದ್ರಿತ್ತು, ಅದಕ್ಕೆ ಬಂದ್ಮೇಲೆ ಚೆನ್ನಾಗಿ ಬರ್ತಾ ಇದೆ. ಅಂದ್ರೆ ಈ ಟ್ರೀಟ್ಮೆಂಟ್ ನಾನು ಹಂಗೆ ಕಂಟಿನ್ಯೂ ಮಾಡಿದಷ್ಟು ಅದು ಫಾಲ್ ಆಗಲ್ಲ ಅಲ್ಲ ಮುಂದಕ್ಕೆ ಯಾವತ್ತು?
ಇಲ್ಲ ಗಣೇಶ್, it's a wonderful the doubt or a question you are asking. See, as I told you, androgenetic alopecia ಏನಾಗುತ್ತೆ, ಇದು ಹೆರಿಡಿಟರಿ ಹೇರ್ ಲಾಸ್ ಗಣೇಶ್. ನೀವು ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಳ್ದೇ ಇದ್ರೆ ನೀವು ಒರಿಜಿನಲ್ ಆಗಿ ಹೆಂಗಾಗಿದ್ರು ಹಂಗ ಆಗ್ಬಿಡ್ತೀರಾ. ಆ ತರ ಅವಕಾಶನೇ ಕೊಡ್ಬೇಡಿ. ನಿಮ್ಗೆ ತುಂಬಾ ಚೆನ್ನಾಗಿ ಹೇರ್ ಗ್ರೋತ್ ಆಗಿದೆ ಅಂದ್ರೆ ಇಟ್ಸ್ ಸಿಂಪಲ್. ನಾವು ಹೇಳಿರೋ ಮಿನಾಕ್ಸಿಲ್ ದಿನ ಒಂದ್ಸಲ ರಾತ್ರಿ ಹೊತ್ತು ಅಪ್ಲೈ ಮಾಡಿ. ಅಡಿಷನಲ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಏನಾದ್ರು ಬೇಕಿದ್ರೆ ಆಗಾಗ್ಗೆ ಹೇಳ್ತಿರ್ತೀವಿ, PRP ಬೇಕಾ ಬೇಡವಾ ಅಂತ. ಯು ಪ್ಲೀಸ್ ಗೋ ಹೆಡ್. ಸಿ ಐ ಗಾಟ್ ಗಣೇಶ್, ನನ್ನ ಜೊತೆ 2003 ಇಂದ 2021 ತನಕ ಇಷ್ಟು ಪೇಷಂಟ್ಸ್ ನೋಡಿದ್ದೀನಿ ನಾನು. more than 25 lakhs. Probably if you put it across, it could be a Guinness record. ಇಷ್ಟಲ್ಲಿ ಎಷ್ಟು ಜನ 2001 ಇಂದ ಬಂದು ಇವತ್ತಿಗೂ ಹೇರ್ ಉಳಿಸ್ಕೊಂಡು ಇವತ್ತಿಗೂ ದೇ ಆರ್ ಸೋ ಥ್ಯಾಂಕ್ಫುಲ್ ಟು ಮೀ ಅಂಡ್ ಥ್ಯಾಂಕ್ಫುಲ್ ಟು ಕ್ಯೂಟಿಸ್. ಪ್ಲೀಸ್ ಕಂಟಿನ್ಯೂ ಯುವರ್ ಟ್ರೀಟ್ಮೆಂಟ್. ಇಫ್ ದೇರ್ ಇಸ್ ಎನಿ ಪ್ರಾಬ್ಲಮ್ ಇನ್ ಬಿಟ್ವೀನ್, ವಿ ವಿಲ್ ಅಡ್ರೆಸ್ ಯುವರ್ ಇಶ್ಯೂ. ಮಧ್ಯೆ ಏನಾದ್ರು ತೊಂದರೆ ಆದ್ರೆ ಖಂಡಿತ ನಿಮ್ಮನ್ನು ಅಡ್ರೆಸ್ ಮಾಡ್ತೀವಿ. ಬೇರೆ ಏನಾದ್ರು ಟ್ರೀಟ್ಮೆಂಟ್ ನಮ್ಮಲ್ಲಿ ಲಭ್ಯತೆ ಇದ್ರೆ ಅದನ್ನು ಕೊಡ್ತೀವಿ. ಥ್ಯಾಂಕ್ ಯು ಸರ್.
ಪ್ರಾರ್ಥನಾ ಅವರು ಇಲ್ಲ ಇವಾಗ.
ಪ್ರಾರ್ಥನಾ ಅವ್ರ ಬದಲು ನಾನು ನೋಡ್ತೀನಿ. ಇಲ್ಲ, ಪ್ರಾರ್ಥನಾಗಿನ ನೆಕ್ಸ್ಟ್ ಸೀನಿಯರ್ ಡಾಕ್ಟರ್ಸ್ ಇದ್ದಾರೆ, ಅವ್ರು ನೋಡ್ತಾರೆ. ಕ್ಯೂಟಿಸ್ ಇಸ್ ಅನ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್. ಇಲ್ಲಿ ಇದೇ ಡಾಕ್ಟರ್ ಇರಬೇಕು ಅಥವಾ ಇರಬೇಕು ಅಂತಿಲ್ಲ. ಬಿಕಾಸ್ ಎವ್ರಿ ಡಾಕ್ಟರ್ ಹೂ ಕಮ್ಸ್ ಇನ್ ಟು ಕ್ಯೂಟಿಸ್, ದೇ ಹ್ಯಾವ್ ಟು ಗೆಟ್ ಎ ಟ್ರೈನಿಂಗ್ ಫ್ರಮ್ ಮೀ ಅಟ್ ಲೀಸ್ಟ್ ಫಾರ್ ಅಬೌಟ್ 6 months to 1 year. 6 ತಿಂಗಳು 1 ವರ್ಷ ನನ್ನ ಹತ್ರ ಟ್ರೈನಿಂಗ್ ತಗೊಳ್ಳದೆ ಅವ್ರು ಯಾವ ಪೇಷಂಟ್ ಕ್ಯೂಟಿಸ್ ಅಲ್ಲಿ ನೋಡಲ್ಲ ಇಂಡಿಪೆಂಡೆಂಟ್ ಆಗಿ. ಡೋಂಟ್ ವರಿ ಅಟ್ ಆಲ್.
ಓಕೆ ಸರ್, ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು.
Sir, few of like many of them have asked about hair colors, dye how use ಮಾಡೋದು, and like can they use it along with other treatments? So I guess
yeah, very important. Of course, dye can be used along with your treatment for hair loss. Doubt illa. But ಏನಂದ್ರೆ you have to choose your dye. What dye you are going to use. See, there are dyes which are harsh, like powder dyes. Don't never ever use a powder dye, and always use a single sachet dye. One dye once apply ಮಾಡುವಂತದ್ದು use ಮಾಡಿ until it's medically proved. Medically proved ಅಂದ್ರೆ dermatologist ಹತ್ರ ಸಿಗೋ dyes, they are very very safe. Similarly, the companies which produce like L'Oreal, Schwarzkopf, then Garnier, these are very very high quality dyes. So ಯಾವತ್ತಿಗೂ pitch dark dye ತಗೊಳಕೋಬೇಡಿ. Dark black is not advised until unless you are totally white. Dark brown is the one which gives you a very very natural color. So you have to buy a natural color, brown, dark brown. That is how you should use. Initially, probably you will have to use once in every 3 months. Probably it comes down to 6 weeks, 4 weeks, 2 weeks, like that. And they're all very, very safe and sophisticated dyes. If you develop any irritation because of the dye at any point of time, immediately see your dermatologist. They will recognize what is it due to. Because we have a patch test, we can recognize whether it is true to a dye allergy or a chemical which is present in that. There are so many 3 or 4 components which can produce allergy in the hair dye. That we will recognize.
Sir, can we take one more question, sir?
Yeah, one last question.
One last question. Yeah. Yes, sir. Sir, actually, they've asked about any yoga or pranayama for hair growth. That I found little interesting.
I have one last question.
Yes, definitely, Preeti, because the yoga and pranayama will give you a positive energy in the body and mind, correct? So it gives you positive vibes. Whenever you have a positive energy and positive vibes, it stimulates all your tissues and cells of the body. Agreed?
Yes, sir. Yes, sir.
Hair is a very dynamically, metabolically active structure in the body. So naturally, those positive vibes and positive energies will stimulate hair production in the hair. I mean, cell production in the hair, and it gives a benefit. It is a benefit. I agree with that. Yeah.
Yes, sir. I guess Mr. Abhishek wants to ask something. You were speaking, right?
Haan, ma'am.
Abhishek, can I have your last question? It's already 6:15 entering.
Yeah, sure, sir. Sir, ನಾನು genetic hair loss 3 months back ತೋರಿಸಿದ್ದೆ Cutis ಅಲ್ಲೇ.
Okay.
Minoxidil finasteride solution ಮತ್ತೆ ಒಂದು ಇದು ಸಪ್ಲಿಮೆಂಟ್ ಕೊಟ್ಟಿದ್ರು.
Correct, hair supplement, yeah.
ಹೇಳಿದ್ರಲ್ಲ ವಿನೋದ್ ಅವರಿಗೆ ಜೆನೆಟಿಕ್ ಹೇರ್ ಲಾಸ್ ಆದ್ರೆ ಕಂಟಿನ್ಯೂ ಮಾಡ್ಬೇಕು ಟ್ರೀಟ್ಮೆಂಟ್ ಅಂತ.
ಹೌದು.
ಅದು ಸಪ್ಲಿಮೆಂಟ್ ಕಂಟಿನ್ಯೂ 1 year 2 year
ಇಲ್ಲ ಸಪ್ಲಿಮೆಂಟ್ ಕಂಟಿನ್ಯೂ ಮಾಡಂಗಿಲ್ಲ ಅಭಿಷೇಕ್. Supplement is only for a stimulation formation of hair. It is continued only for about 6 to 8 months, not beyond that. ನಿಮ್ಗೆ ಅದಾದ್ಮೇಲೆ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ಓನ್ಲಿ ಟಾಪಿಕಲ್ ಮೆಡಿಸನ್ ಇರುತ್ತೆ. ಅಡಿಷನಲಿ ನಿಮ್ಗೆ ಏನಾದ್ರು ಹೇರ್ ನಾವು ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮಾಡಿರೋ ಮಟ್ಟಕ್ಕೆ ಏನಾದ್ರು ದಪ್ಪ ಆಗ್ತಿಲ್ಲ ಅಂದ್ರೆ ವಿ ಡೂ PRP ಅಂಡ್ ವಿ ಡೂ LLLT. ದಟ್ಸ್ ಇಟ್. ಸೊ 3 months ಅಲ್ಲಿ ನೀವು ಇದೀರಾ ಇನ್ನು. ವೆನ್ ಯು ಕಮ್ ನೆಕ್ಸ್ಟ್ ಟೈಮ್ ಯು ಸಿ ಟು ದಟ್. ನೀವೇ ನಿಮ್ದು ಹಳೆ ಫೋಟೋಗ್ರಾಫ್ ನಿಮ್ದು ಹೊಸ ಫೋಟೋಗ್ರಾಫ್ನ ಕಂಪೇರ್ ಮಾಡಿ ನೋಡಿ how beautifully it is grown. ಅಲ್ಲಿ ಏನಾರ ಡಿಫಿಷಿಯನ್ಸಿ ಇದ್ರೆ we'll tell you the additional treatment or add-on treatments. Okay.
Sir, I guess we'll end the session, sir. We have almost covered all the topics, sir.
Okay. So, and in addition to that, Preeti will try to address the issues of the patients who are there in the program, and yes, individually we'll group them into questions on dye, questions on minoxidil, questions on finasteride, questions on hair supplements, like that. We will make a division, and yes, accordingly we'll address those issues.
Sure, sir. Okay. So thank you so much, sir, for your time.
Thank you so much. Thank you so much.
Yes, sir. So I guess we have.
Be safe, be at home. Yes, lockdown is coming down, the rate is coming down. Don't ever think that corona has gone. We cannot go in such a way. Please be safe. Always follow those practices of mask, then the distance, sanitization. Okay. So please do that. SMS. Sanitize, mask, social distance. SMS. Okay. Yes. Thank you so much.
Thank you all. I hope we have helped you. So visit us at our Cutis website, or you can have a video consultation with us. We are open. You can, from the comfort of your home, you can video consult us, and do contact, call us, mail us. We are here to help you and serve you better. Thank you, everyone.
Hello.